Welcome back. Well, today from Harvard Eye Associates, we have Dr. Nicoletta Stefanidis. And doctor, today we are talking about, well, eye strain and people that get headaches and neck pain and something called misalignment of vision.
Right.
So welcome.
Thank
Great
you.
to have you here today.
Thank you.
Tell me about this. We have several slides we're kind of going to go through here.
Yep.
But I have heard about this kind of before. I mean, even years ago, eye strain from looking at computers. Well, that was the days before we had smartphones and tablets and everything else. So it's just gotten worse over the years, right?
Right. It sure has. And this new technology that we're talking about today, it's called the neurolens. It's been around a while, but the development has become more sophisticated in the last couple of years. And we now have a way to measure people's misalignment very accurately so that we can prescribe what we call a neurolens to help these patients who suffer from headaches, neck strain, dry eye. So it's a really nice new technology that our patients are very successul with.
Now, you have a graph here that shows how things have changed, and this goes back to 2005, and of course 2005, if I'm not mistaken, marked the start of really the smartphones, the iPhone and that really began to change things a lot.
Yeah, you can see how many subscriptions from 2005 to, I mean, everyone's carrying a smartphone. And it's not only just the smartphones that people are on, but their work. They're on computers.
Right.
I have patients tell me they're on them 9 to 12 hours a day.
Right.
And then they go home and maybe do another hour or two. So.
Well, you know, you bring up a very good point, because for good or bad, probably more bad, we go home, we meaning myself, my wife, my daughter, and what do? We no longer, well, not as much look at a TV as much anymore, which is still close, but it's 10 feet away or whatever it might be. We're all looking at something up close, looking at our own thing, reading our email, whatever it might be.
Right.
So there's even at home, there's a huge shift.
Yeah, and people who are watching their shows are probably doing it on an iPad. They're probably maybe not doing it on their smart TV. It just depends on what you like to do.
So it's called, on the next slide, it's called digital vision syndrome.
Yes.
Yeah.
Right.
And it shows a percentage of Americans that report these problems, and
that's a high percentage. 65% of Americans, 9 out of 10 people, are using these devices 2 or more hours a day, and I think that's actually probably a low number.
Yeah.
I think we're on it way more than 2 2 hours a day. But it's interesting because this neck, shoulder, and back pain, it's a pretty high percentage there, 36%. Headaches, blurred vision, dry eyes, all of these things are addressed with the neurolens.
Yeah.
And I have done probably, in our practice, maybe 25 patients with the lenses.
Wow.
And I haven't had one patient not report that they're seeing so much better and feeling so much better. So not only are they feeling better, but the optics in the lens is incredible.
Right, right. And as we go through the next few slides, it just shows some quick graphs of the different percentages of people. You know, it's interesting in one of these in the next slide, adults under 30, I mean, it's just incredible that have that problem. So now one of the slides here, breakthrough eye brain discovery is really interesting, because here's the graph that shows the difference. Adults under 30, that's what's really telling.
Yeah.
And the reason is for them, it's only going to get worse more than likely.
Yeah.
Because soon we're now talking about virtual reality glasses. Now you're looking at something that is inches away from you. It's not even that,
and these,
half inch.
Yeah, these people under 30, the millennials, we know that they have grown up in a world where everything is digitized.
Yeah.
So that's their whole world.
Right.
I have 2 kids that can report that.
Yeah. Well, no, that's true.
Yeah.
So you look at these different graphs and slides here, and we go through these, and another one, it shows nearly 60% of Americans use digital devices 5 or more hours a day. Yes, of course.
Yes.
I think that's very true. And 70% of Americans use 2 or more devices, in 77 of individuals who suffer from digital eye strain are using 2 or more devices simultaneously.
Yeah. So in their workspace, they might have 2 or 3 monitors. They might be at different distances, so their eyes are constantly having to readjust for the distance and the screen.
Yeah.
And you know what? Our older population, they're very savvy, so they are using a lot of digital devices too.
Right.
Very much so.
Yeah. And on the next slide, it just shows more of these type of symptoms. And now here's something that's interesting. Only 10% of patients report their symptoms to doctors. And I can remember, I'm thinking back when I got my first computer, in the mid-90s. And after about a year having it, I think I went to an eye doctor and said, are there any such thing as computer glasses? And I remember they told me, they go, well, you can buy these over-the-counter things. They have like a blue tint on them to help that. So even back then, I remember noticing something.
Yeah.
Because it was brand new, and all of a sudden, back then you weren't watching TV on or anything like that, but
you were using your computer.
You were using it,
yes.
Right? You got mail.
That's right.
Yeah, I remember that. And
And it was kind of fun to get the mail.
It was. Yeah, you were sad if you didn't.
Yeah, and it's like, oh, wow, what's in my inbox?
Yeah. So breakthrough eye brain discovery, and this is what you were talking about, misalignment of your eyes. So explain that.
So what happens is that when we look at something far away versus something that's up close, our eyes have to make different movements and they have to focus differently. So when we look far away, our vision, we don't have to focus as hard and our eyes tend to diverge. When we look up close, we have to focus harder and our eyes have to turn at the same time. So we have 2 things going on there, focusing and turning. And if those things are inefficient in our visual system, then we have symptoms.
Okay. It's interesting how our vision was created because, or the real reason is to see off into the distance. You go back in the days of, early life. There were hunters. They were seeing what the dangers were out there and that sort of thing.
Right.
And obviously, even during the Middle Ages, when people started to get printed material, things started to change back then. You kind of wonder if 300-400 years from now, our eyes are going to become a little bit smaller and look more inward. I mean, who knows?
Yeah, who knows?
Yes.
Yeah.
So there are everyday symptoms, and 56 of the people have these symptoms. And I know for me, it's only when I'm looking at a desktop computer that I will, for a length of time, that I will get neck and shoulder. It doesn't happen with my iPad or anything else, probably because most of the time I'm at home, I'm comfortable in a chair, I have my iPad propped the way I want it. I might change positions.
But the thing about this neurolens that's interesting is that the trigeminal nerve, which is cranial nerve 5, it innervates the eyes, the face, the neck, and the shoulders. So when the trigeminal nerve is overworking, that's where you're getting these symptoms. Okay,
and obviously dry eyes, eye strain, blurred vision, that sort of thing.
Yeah, the dry eyes has to do with how the trigeminal nerves innervates the lids and the positioning of the lids.
Okay.
Yeah.
All right. Now, and then of course you were talking earlier about device overload, how much we use these, and it's only going to get more and more as the the younger population, it's going to be just normal. It's normal for them already.
Normal. Right.
I look at my daughter compared to my older daughter, and compared to us, it's every 10 years it drastically changes.
Yeah.
Yeah, it really does. So, origins of the problem predate today's digital demand. Like we were saying, it probably goes back to the days of when the printed word and books became widely available for people.
I think that's why, so many people that are using all of the new technology and they want to enjoy the technology, but they're having the symptoms, and they'll come in and they will complain about how uncomfortable they are and what can you do to help me. And this new neurolens is something that I think is exciting and is important for patients to experience.
Okay, so eye alignment basics, is it something that when someone goes in to have their eyes exam, is this part of a normal eye exam now, or must you kind of say, I'm having these symptoms?
That's a good question. So
yeah,
we
or
have
should it become part of the norm?
Yes, we have a questionnaire that every patient gets that identifies symptoms that we're looking for that could potentially be a part of eye misalignment. If they identify themselves on the questionnaire, then we will test them. There is a unit that they will sit in. It's about a 4-minute test, and you see a bunch of balls bouncing around, and the technician will direct them on where to look, and it actually will help us determine how misaligned their eyes are.
Okay.
Yeah.
Because it's something that, I don't generally get headaches. I do not. I'm just talking about for me, get dizziness or dry eyes that often. So,
yeah.
I wear these, again, these are like 2.5 readers or whatever it is, and because I'm cheap and I don't want to go out and get prescription lenses. But you know what, I can see where I know many people where this does affect, and I'm sure it does affect me to some degree.
Yes.
Yeah. And you get kind of, you're staring at something that has that glare right in front of you.
Yeah, what they say about the neurolens is that, the most you can expect is that you're symptom free.
Yeah.
But in addition to that, you have such great quality of vision because the optics of the lens are incredible. And patients report that. They get the lens and they go, wow, I've never seen this great.
So let me ask you something about this. These are glasses. These aren't implants.
No.
Because we hear so much about different kinds of implants. Is this something that if someone goes and you get your normal prescription, whatever it is, that this is put on top of that prescription? Is it an addition?
It's in the lens.
It's in the lens.
So what they do is they figure out what your prescription is, and then they build in a variable prism effect.
Okay.
Which means that when you look far away through the lens, the prism helps your eyes line up a certain way. When you look close, you have a different amount of prism that helps your eyes line up easier in the close range.
Okay.
And people say, well, I wear contacts. Can I still wear this lens? You can wear a pair of glasses over your contacts that has the prismatic effect from the lens in it.
Okay.
So.
What about the folks that, I know certain implants that people get the lenses put in that have that Fresnel lens type situation. Some of the newer ones already have those steps sort of built into them. Yeah. Do you understand what you know?
Yeah, I do.
I forget the name of the company now.
Yes. So the multifocal implants, implants, and now we have an extended depth of focus implant. Can you wear a neurolens with that? If you have symptoms, the thing about this lens is you should try it, because if it doesn't work for you, the manufacturer who makes the lens is so confident about their technology that if it doesn't work for you and your symptoms don't go away, they'll refund you the lens. Okay. So it's not, you don't have anything to lose other than losing your symptoms.
Okay. What about if my eyesight is okay? I use just these readers here. Yeah. Can I just go in? I want to get these. Yeah. So from whenever I'm on my iPad or computer, I put these on.
Yes. So for you would have the power that you need, which is 250. You told me you're wearing. So you would have your 250 power in there. Plus you would have the variable prismatic effect from the neurolens.
Wow. And at this point, what's the cost for these? It's probably not covered by insurance at this point.
No, not covered by insurance, neither vision or medical.
Okay.
For a single vision lens, it's about $800.
Okay.
Again, 92% of the patients that buy the lens are very, very happy with it.
Okay.
So that's their success rate. And if you're having enough symptoms that you're really needing something, the $800 doesn't mean a whole lot.
Right. So. And of course, with everything else we've seen, like the lens implants over the last 10 years, all that's going to go down in cost. I mean, it's amazing as the technology goes forward. These are fairly new, am I right?
Yes, fairly new. Probably, they've probably been around maybe 5 to 7 years.
Okay.
Yeah. And what's getting better about this is how they measure the patient's misalignment. So the technology that's being created to help us determine what lens they need.
Yeah, but I can see how this could be a great benefit to someone.
I'm telling you, my patients have been very, very happy.
Yeah, and it wouldn't be nice if insurance, but you know how insurance is.
Yes.
Seems to come with eye care and dental care.
Yeah.
They're always like stuck 20 years ago.
Right.
You don't need those contacts, just do that. Just go out and buy glasses. Oh, well, I think this is great. And again, it's up to, at least at this point, for the individual to allow their eye care provider to let them know that
Right.
they're having these problems, and then it's sort of built into their eye exam.
Right.
Is that how it is?
Yes, it is.
Okay, so it's part of it.
Yes.
Is there an additional fee for that part of the
No.
eye exam? Okay, and then
No.
maybe one day, I'm sure it's going to become a norm, because
I hope so.
as you know, my daughter and anyone really under 30, as they age, this is
Yes.
going to be a
And
normal
patients
thing,
that
yeah.
want to know more information about that, they have a website, neurolens.com.
Okay.
I always tell patients, go to their website, read about it. If you have questions, give me a call. It's available.
All right.
Okay.
Thank you. That's
Thank
great
you.
information.
Yeah.
I appreciate it. Always
Yeah.
good to see you, folks.
Nice to see you.
Take care.
All right.
We'll be right back. Oh, we'll get you a note.
Oh, thank you.